Diabetes mellitus is a disease that occurs as a result of high glucose or sugar in the blood. It is as a result of the failure of the pancreas to produce insulin, or the inability of the cells in the body to use insulin effectively. Insulin is a hormone that maintains blood sugar level in the body. Glucose is the main source of energy for the body. It comes from the carbohydrates in food and drinks we consumed. When glucose is in our bloodstream, it needs a key or a hormone called insulin to help it reach to organs and cells of the body, where it is used to provide energy for use by the body. If the pancreas is not producing enough insulin, or the body is not using it properly, glucose builds up in the bloodstream, causing hyperglycemia. There are several types of diabetes mellitus, but in this video, we will be talking about the 4 most common forms. Type 1 diabetes, Type 2 diabetes, prediabetes, and gestational diabetes. Type 1 diabetes. This type of diabetes is autoimmune. The immune system attacks and destroys insulin-producing cells in the pancreas for an unknown reason. It is mostly diagnosed in children, although it can develop at any age. It is characterized by a rapid and sudden display of its signs and symptoms. Its signs include frequent urination, increased hunger and thirst, nausea, fatigue, blurred vision, dry mouth and weight loss. Type 2 diabetes. This is the most common form of diabetes. It mostly affects adults, but children can be affected as well. In this type of diabetes, the pancreatic cells do not produce enough insulin, and the body's cells stopped responding to insulin. The cells here are called insulin resistance, because they do not respond to insulin. The signs and symptoms of type 2 diabetes are similar to type 1 diabetes, however, they develop slowly and are very mild. They include constant hunger and thirst, frequent urination, fatigue, blurry vision, poor wound healing, lack of energy, pains, tingling or numbness in hands or feet, and excessive weight loss. As the disease progresses, the symptoms become more severe and can cause some potentially dangerous complications. Prediabetes. This type is the stage before type 2 diabetes. The glucose level are higher than normal, however, not high enough to be officially diagnosed with type 2 diabetes. It is mostly symptomless in most people. The mostly common symptoms are extreme hunger and weight gain. Prediabetes can be reversed to normal blood sugar by exercising regularly, eating a healthy diet, maintaining a normal weight and not smoking. Gestational diabetes. This type of diabetes develops mostly in women during pregnancy. It may dissolve immediately after delivery. However, people with gestational diabetes are at higher risk of developing type 2 diabetes later in life. In order to prevent or reduce the risk of being diagnosed with diabetes, it is important to keep your weight under control, exercise regularly, eating a healthy diet, and not smoking.